Good afternoon, everybody. Thank you for allowing me to present Arrow Diagnostics. We combine nanotechnology and machine learning to develop inexpensive diagnostics for a variety of applications. Currently, though, we're focused on developing a non-invasive diagnostic test for early detection of non-alcoholic fatty liver disease. So how do we do this? Well, we've taken surface-enhanced Raman spectroscopy, a chemical analytical technique that's been around for over 2 decades, but has been plagued by low sensitivity and reproducibility. And so how have we solved that problem at ArrowDX? We've created hotspots, and these hotspots are proprietary surface chemistry that we deposit on glass slides or silicon wafers, and we customize the detection to the compound of interest. In the case of NAFLD, we're working with doctors from Boston Medical Center that have selected 3 candidates that are key biomarkers that they have gone through clinical trials that are signatures for the advanced form of the disease. So just to make it in a nutshell, we've done some work with enzymes already, and we also did a comparison to non-biological compounds as well. So we've been able to maintain the enhanced sensitivity and reproducibility. So why NAFLD? It's a disease that affects 1/4 of the Western population, and what's very different about this disease is it's asymptomatic in the earliest stages. We at Arrow Diagnostics aim to work on the first 2 stages of the disease, non-alcoholic fatty liver and non-alcoholic steatohepatitis. At these 2 stages, it's extremely hard to detect. Even if your liver enzymes are elevated, it doesn't tell the doctor that much. And so what's critical about the first 2 stages is that if you can detect the disease there, you may have heard there's about 6 to 10 companies working on therapies for NASH. And we've been spoken to a few of them. So with the therapies coming online that will be approved by the FDA in the next 6 months, combined with lifestyle changes, it's very critical to catch these individuals in these 2 stages. Once the individual is down to cirrhosis or hepatocellular carcinoma, it's basically a death sentence. At that point, you're a candidate for liver transplant. So we aim to work with our collaborators in the first 2 stages. So what are we doing here? We have a chip, a glass slide or a wafer with proprietary nanoparticles, but we're also bringing in machine learning. And why are we doing that? Diseases are very complex, as we all know, and NAFLD is one of them. And so working with collaborators at Northeastern University, we want to be able to tell the physician and the patient more than just they have biomarker XYZ. We want to be able to tell the patient, hey, you have a 40% chance of getting the advanced form in the next 6 months if you don't change your lifestyle. What's very nice about our chip is that it can be used in any existing Raman spectrometer, or we've worked with a collaborator at University of Illinois where we've taken a smartphone and made it into many spectrometers. So the test can be done in the doctor's office, or some lab or some research institution can buy our chip and use our existing instrumentation. So the market, it's a market that's developing because at this time, there's no non-invasive test for detecting early stage non-alcoholic fatty liver disease. So based on our calculations, the market's roughly 500 million in the United States, and that's what we're working with. Our team, this is our day-to-day team. Edward and Ian, I'm the chemist and so is Ian. We both have degrees in physical chemistry and nanotechnology, worked in industry for 10 years and then started a company. Jared and Malin are MBAs. Jared's out of Keck Institute in California. Malin's out of Northeastern University. So our team here complements each other. We do the chemistry. Jared and Malin work on the business side. In terms of collaborators, Andrea Tell is a great chemist out of UC San Diego. She's been working in Raman spectroscopy for over a decade. So together with Andrea Tao, we go through a lot of the chemistry vetting. Brian Cunningham, University of Illinois, is helping us fabricate instruments. Bob Bazzelli is at Terra Nova Capital as a business advisor. And Brian Christie, you may have heard of him. He was a former CNN anchor. What's very critical about Brian is he was diagnosed with this disease about a decade ago. And he has a lot of trouble with the disease. And he's an example of why it's critical to detect the disease early before it causes a lot of damage.